So, warm welcome to all our doctors. So, today take home message very clear from Dr. Naveen sir. Young patients, including ourselves, we don't know what's happening inside our heart. So we have full-fledged cardiac and neuro department at Onus Robotic Hospitals. We have 128 slides cardiac CT. That patient who is known to me, very close friend of mine since childhood. So he came all the way from Tirupati. So he thought nothing would be there. So, but the gut feeling saying that let me show to our cardiologist. So he insisted for CT angio, and then find out 99% of the block. So I request everyone in this group, you are like our Onus family members. So anytime you can come to our hospital and check your heart and meet our cardiologist, because no super specialty hospitals in Hyderabad will entertain these kind of services to our doctors. So anytime we have services 10:30 to 8:30. So come and check it. CT angiogram, 2D echo, ECG, everything. We can do it free of cost. So this you should help our referral doctors. Yeah. So I'll complete presentation in less than 5 minutes. So many of you know I do robotics, and thank you all our doctors, Vasanthi madam, KCR, and then Ravikiran sir, and then other team. So now Onus Robotic Hospital is multi-specialty hospital, and thank you all the doctors for trusting our hospital. So robotics means Onus means Balaraju Naidu. So that's the trend we created in this East Hyderabad. Many people looked at us, why is bringing robotics, why is bringing cath lab, why is bringing CT scan 128 slice. Whatever corporate hospitals in East Hyderabad have, we have that equipment at a very affordable cost. You tell me do stenting in 70,000 means we'll do it 70,000. You ask me do knee replacement surgery bilateral 1.8 lakhs, we'll do it. Because we want to disrupt the industry of healthcare. In the future we are bringing Onus health card, pay 999 rupees, 1,000 rupees you pay, everything will be free. We are going to disrupt the industry. Pay 10,000 rupees per person, everything will be free, including liver transplant. That kind of healthcare we want to bring in the future. Not now, but it will take little time. We are in that process of doing disruption of the healthcare. So today, almost 20% of the patients are unhappy with the knee replacement surgery, whether it is our relative, our mother, or anything. So that's where robotics came. Robotics will be like Siam. And take my words, in 2030, almost all the doctors will be replaced by the AI and robotics and virtual reality. So this is my word, it will be happen. So many people think that surgery will be done by like muscular guys and need to give traction, all that. That is, these are gone. 90% of my work by robot. So 10% means nothing. You go to the theater and come out for joint replacements especially. Next in this month end I am going to Australia, bringing arthroscopic robot, which is the world first time we are bringing to India. So you see arthroscopy also disrupted. Next trauma surgeries will be replaced by robots. So lot of work is going on and that's happening. So preoperatively we may not bring the correct alignment so that patient knee replacement should sustain for 35 years. So many patients, when we check HbA1c level, it will be more than 9 or 10. Usually we recommend 7. If it is 8 is there, ruthlessly we reject that case. So if it is more than 8, don't do replacement surgery. Radiological planning, most of the time before coming to robotics, the problem we are facing, alignment may be correct or not. So more than 3 degrees to 5 degrees valgus, it is bound to fail in next 5 to 10 years. So when we check the old data of our patient who are undergoing knee revision surgery at Onus, we see that patient might be having an improper alignment. Maybe we are not able to replace the original kinematics of the knee. So ligament balancing, this is one of the major problem most of the surgeon while doing the severe complex knees we are facing. Like we will be injuring grade 1 sprain or grade 2 sprain on the MCL. Definitely it's going to fail after 3-4 years. So that's where robotics plays a very important role. We will be able to restore normal kinematics whatever the patient has 30 years earlier. So implant selection also, whenever we ask for robotic surgeon, we need C-size implant, exactly the C-size implant won't be there while doing the surgery. So with the help of robotics we can tell that C-size the implant for femur, you need to arrange that implant. These guys are able to arrange that exact implant. That's the problem we are facing, overcoming. The other issue is infection. As infection, every orthopedic surgeon is worried about infection. So we should be very clear while dealing with knee replacement surgeries. So I make sure that pus cells should not be there, at least less than 4 to 6. And then HbA1c should be less than 8. If it is less than 7, it is a good. If more than 8, no way I'll reject the case. And recently we are, cardiac department started 1.5 years back. If I send 10 cases, they are rejecting 8 cases. They'll say angiogram, then patient will go to other hospital. So it's okay. Rather than patient dying on the table or dying post-operatively inside the corridor. I've seen many cases in my previous hospital. When I worked in Sunshine, every day we are doing 25 surgeries. So it will be usually evaluated by diploma cardiologist. They may not pick up the severe lesions or early lesions. So patients are dying while doing the surgery or while they are walking inside the theatre. Code blue is announced. So you see, whenever patient walking into the theatre and then dying in the operation theatre, nobody likes it. I am happy to lose my patients. It's okay. But I am saving the patient side. That's what I feel. Everything is ready. Every payment is done. 6 lakhs paid for bilateral take care. They go to Naveen sir. They say, you will reject the case. You need to undergo angiogram. Patient will not accept that. That's okay. Because I am leaving to them. Then they go to corporate hospital. Then something, it will happen. We don't know, which is not in our control. Next slide, please. So post-operative issues with robotic surgery, very less post-operative rehabilitation is required. And robotics, yes, it is going to a major role, and it has decreased the burden of main surgeon, to at least 80% work is reduced. And when revision becomes necessary, when there is a failure of the primary implant, and always we can opt for revision surgery, but revision surgeries are very painful regarding implant selection, regarding payments, and Indian patients are very reluctant to undergo revision surgeries because surgery starts from 8 lakhs to 9 lakhs. So at Onus Robotic Hospital, we have state-of-art technology regarding infection control program. We have HIC programmers who can really deal with while they are in the patient inside the ICU, OT and CSHT. This is a small video how I do robotics. This is for new doctors who are coming here. And this is the J-Planner software. Within 2 minutes, it will give the exact whether I am able to restore or not. And if you look at this model, you see here, I am able to see 0.1 mm gap. 0.1 mm, it is not even, you can see 1 mm. You can see 0.1 mm gap. This is the final picture before operating. Once the model is there is no surgeon you can see inside the theatre. In the future, in the next 1 year, we want to launch a virtual reality where there is no need of surgeon sitting in the OPD. Surgeon can be in the beach, in the Bali, or they can be in Dubai, they can see their OPD exactly however you want to see. Patient don't know where he is, doctor is, but patient can experience that feel that doctor is beside you, beside in front of you only. That's the virtual reality and augmented reality we want to bring. And this is the robotic surgery where patient can interact with us. And error rate, many people ask, it is negligible, not even 0.1% I can say. And the beauty is here surgeon load is decreased by 80%. And this is how their patients are walking 3 to 4 days after surgery. And 95% to 99% of the patient asking for robotic surgery. Whether you love it or not, it is patient demand. Many people ask, it is a marketing stunt. Whatever you do, corporates make sure that patient will ask. So once again, very, very thank you to all for your patience, and really sorry for the delay. I think once again, thank you all. If you have any doubts, you can speak to our team. Thank you once again.